when I came out, I thought I was doing a herb walk. So I don't have, these are things that I went around and Tara kindly brought some in, and Roisin brought some in. So we have an accumulation of things that are both native, but also things that you find in your parks and in your garden that might have been brought in from other countries or given to you by neighbours or you got in the nursery. And that reflects really, I use native plants, but I also use an eclectic mix of herbs from around the world, because we've been trading herbs and medical information about spices and medicinal plants since the Silk Routes. This isn't just since Ryanair, this is since the Silk Routes. And people used to travel extraordinary distances to exchange information and knowledge. The old Irish medical system, going back to this era, was highly knowledgeable and highly integrated with continental centres of learning, particularly Salerno, and later through the flight of the Earls, when most of the learned doctors would have gone, who had this professional training, would have gone to Vienna and followed the aristocracy, because it was the end of patronage. All systems of medicine, all over the world, have a system of patronage. At the moment, it's the government, and the government is highly invested in scientific biomedicine. In times of chieftains, they would have been the main patronage system, and the doctors were, the Lia, were considered of very, very high stature, and they were paid in terms of the amount of land that they could use and servants that they would have. And there was a whole system whereby they were paid by the chieftains to look after people according to their rank, including right down to the serfs and the feudal system of labour. So it was a very learned system. When that left, we were left with folk and traditional medicine. So we had a history of both. About 2 years ago was the anniversary of Tiesel Queen's medical treatise on the herbs that he used. And the Druids of Midfy wrote their medieval herbs that they use. And of both of those texts from independent sources, I would still use those herbs. They're the mainstay of my clinical practice going back 800 years and previously. Because and all of this is based on empirical science. How do you learn how to put a nail in a post? Right, you watch somebody doing it, and then you start your first one, and then you hit your thumb, and you go, oh, that wasn't a good idea, and then you keep doing it, and then you teach somebody else to do it. It's the same with medicine. We learn by experience. And these have all been tried and tested for 8,000 years. We're not talking about 20 to 30 years and then finding out that the hammer was so strong. You see, using drugs, and my philosophy or ideology is collaborative medicine, but I'm here to talk to you about herbs today, so it's entirely biased. You got that? Okay. Because the biomedicine model has had the last 300 years to totally convince us that it's the only way to go. They have had 99.008% of the funding to do research. So when people say to me, what's the research evidence? I go, we have 0.002% based on the House of Lords report, and I have no updates since then, for all of complementary medicine, including herbal medicine, of the research budget. And virtually all of that supports the traditional use, learned by empirical science of experience over multiple generations, both oral and written. Okay? The bottom line is, using herbal medicines, I sleep a lot easier. Yeah? That's how more reassuring it is. I sleep a lot easier. If I sleep a lot easier prescribing this stuff, can you feel a lot easier taking it? To harm you with any of these, I would have to work extremely hard, and I would probably have to find a way of putting massive amounts of this stuff into you. Like, use all of it. That would be very hard, wouldn't it? Especially because most of this stuff doesn't taste good. These don't taste like donuts. Okay? So there's an inbuilt way of limiting. Usually the more toxic, most of the really deadly poisons from plants, because I'm not saying a lot of deadly poisons from plants, are so bitter that to poison somebody, you have to seriously disguise it. Okay? But we know from experience which are the ones that poison people. And if you're a medicinal doctor or a medicinal herbalist, guess what, guys? You just don't use those ones. Right? Most of the herbs that I use are nourishing. They're wild oats, red clover, nettles, dandelions, elderflowers, plantain, meadowsweet. I can't poison with any of these, it just wouldn't work. Right? If I wanted to inherit the kingdom, I wouldn't have a chance. Right? So that's how they found out about most of these poisons, right? Because they would try and knock people off with them. They know exactly how much to use and how to use it. As you know from reading Agatha Christie's. Yeah? So let's get back to what's in the... So when I arrived today and I saw the mown grass, I thought, oh, Lord, I can't find anything in here. But of course I did. Nature always turns up trumps. Anybody know what this is?
Yeah, great for tea.
Which?
Great for tea. Well, we call it lipa. I don't know in English, sorry.
Yeah, say again, what do you call it?
Lipa.
Lipa, okay. We call it lime flower, or linden, or tilia is the Latin name, Tilia Europaea. This is a bit late in the season. If you go early, you take it in the springtime. Yeah. Where are you from?
Slovenia.
Yeah. I always know, I'm at the college, there's several of these that droop quite low, and anytime I go to dangling nurseries, if there's somebody picking them, I know they're from Eastern Europe. It's just a question of where. Because you guys haven't lost it. We've lost it. Partly because of 800 years of colonisation. As soon as we sent the colonizers home, and even during it, we wanted to be like the people in the big house. We thought this was the good medicine. If it was good enough for the posh people in the big, that was the one we wanted. Not realising that we were giving up an awful lot in letting go of our own. Then when I was driving somewhere on the radio, there was an Italian guy talking about nettles and using nettles in food, and he had this great, I can't do it, I can't do an Italian accent. Just laughing, you know how bad I am at accents. Or the nettles, they are so wonderful, we can do them like we can really be, you know, so exotic and so sexy, and you know, like that. So
it's great, I've got this recorded,
so
it's great.
And I thought, I'll just have to become Italian to make nettles sexy. But more down to earth, the patient did tell me that her family came with the era of Italian fish and chippers, right? And they all came from a particular area in Italy. And they came to the north first, and then they spread out and spread south when they saturated the north with fish and chippers and put them into new outlets. But one of the grandfathers was visiting, and he was picking nettles for nettle soup and to feed the family. And he met a neighbour, and the neighbour said, "Oh, how many goslings have you?" Because the Irish would only give their nettles to the animals to eat, and they're so nourishing. But the grandfather, the Italian grandfather, knew enough not to pretend to be a peasant from the countryside in Italy. So he went along with the notion that he had 5 goslings at home. Think of 5 grandchildren. But that's how far, in many ways, Irish people are much closer to the land because we all come from a farm, not too far from here, within 2 generations. But in another way, we've been mentally colonised to think that this isn't the best, that we have to go and learn fancy stuff and take the colonizers' medicine. Yeah? So it's interesting. So this is the lime flower. It's collected in the spring when this has a lovely, pretty flower, and it's the flower and the bracts that are put in your teapot. Yeah, is that what you do? Yeah. It's lovely. If you get honey that's made around these, it's a very, very nice honey. Very sweet honey. So if you want to pass those around, if you want to see the tree, it's on the other side of the castle wall, over towards the river. So what do we use it for? That would be good information, wouldn't it? This is lovely for restless children, children who can't sleep. It's very good for hay fever, along with nettles and elderflower. It's good for all of the mucous membranes and calming, right? Very good for all ages, particularly nice for children. Yeah, and you can collect them in the spring, and you can dry them. To dry herbs, you get anything like a wrap. The best thing is when you've finished drying your clothes in the winter, you know those top hanging things for drying your clothes. Put a net curtain over that, or something that lets the air breathe, and just dry them like that. And the other thing, people ask me, how do you take herbs? You see, everything is provided for us. I don't know who owns this lovely teacup with a book under it that describes the vintage teacup club. Okay? But people say, what's the best way to take these? And it is in a teapot, and we have some lovely examples here. Can you believe it? Right. They must have known I was going. So we get a nice teapot, and we set the table and do a nice ritual. And look, there's one like a florist. So we surround ourselves. You see, the other thing we've lost is the ritual of tea. We've lost a lot of rituals, which is a real shame. So sharing a pot of tea and having your favourite cup and saucer, and actually Laura went to visit friends down in Kerry, and she said from her parents' generation, they were all going to meet each other up, and you commented, and they took out the best china. And we lost the best china. You know, isn't it lovely to have a tea ritual? We don't have any geisha girls now, we don't have to go that far. But you know what I mean, to have the cup of tea. So the best way to use most herbs is water just off the boil, so you don't destroy all the flavonoids, and then let it sit and rest and chat away and have your cup of tea. So, yeah. Having said that, do we have an example of any of the boxes of 3 teaspoon tea bags?
No, I get some in a while
I
though.
have virtually given up on expecting Galway people, and I can sympathise because I find it difficult myself, to take the loose herbs, because you have to clean out a teapot, and we've all got so impatient, right? This kind of ritual all goes with mindfulness, which is all the buzzword of the day. But in order to use herbal medicine, you need regular compliance. You see, these look lovely, but I don't put them into my tummy. They're not going to do me very much. I don't mean they will. It's lovely, what a lovely display. And even the gardening is is healing, right? So what we need is, so what I do is I actually pay somebody to do 3 teaspoons into a tea bag, fold it over and seal it, and put it in 14-day packets, so that if you need digestive herbs, we have digestive herbs. If you need hay fever herbs, we have hay fever, and they're all organised in a tea bag for you. They're a little bit more expensive because obviously I have to pay somebody to put them in. So we also have them loose. You can go home and do it yourself. So some people are time rich and money poor. Other people are money poor and time rich. So either way, the best way to do all of this is to grow your own. But given that that's a step too far for a lot of people, we have every opportunity for you. We also courier them, so you can phone us up or go online and we can courier them for you as well.
To drclareapothecary.com, just so you know.
drclareapothecary.com, or there's a card there.
Yeah.
Now, there's other herbs. Do any of you know what that is?
Tiesel.
Tiesel. So it's also used for carding wool, and that's the seed head. And I mentioned
Rhymes
this.
with weasel.
Rhymes with weasel.
Yes, it's in there.
We have a wordsmith. So this is this is an example I've done Roshi. I pay somebody to put those 3 teaspoons in, fold it over, and make life easy for you. Okay. I get much better results. We've been doing this for what, a year and a half?
About 3 years now, yeah. Yeah.
This is baseline. That's 3 teaspoons. And you can make it the night before, you can drink it hot or cold, but either way, you see, this is what I mean about compliance. There's no point in knowing about all of this if you don't actually down into the tummy. Yeah. But teas are brilliant. So now I want to talk to you about different kinds of evidence. This is, you know, there's a huge controversy about Lyme disease at the moment, and I wanted to refer to it more. And there's one study done on using Tiesel, only one study, and it's barely on a speck of scientific evidence. It's about that much, okay? And everybody is going mad and paying huge amounts of money for formulas that include Tiesel. I was in the States about 3 years ago, and at one of the conferences I spoke to a lot of the herbalists, and there was a talk on using Lyme disease. And medical herbalists in the States, where Lyme is much more common because the ticks are more, it's spread amazing and extraordinarily. They haven't found it particularly useful. But the media will again pick up on one thing and one report and one writing in a book. Whereas to me that's not, traditionally, this has not been used for the immune system. Like if I broke my foot last week because a ladder slipped from under me, and I've been taking comfrey internally, externally, and also going back. So comfrey is known as knit bone in every language and every vernacular between here and the steppes of Russia, extending to the Armenians. I find that much more satisfying as evidence than a scientific report in an isolated journal picked up by the media and latched onto by a self-help system. Okay? It's taking the biomedical medicine scientific rationale too far. Okay? Does that make sense? So that was one of the reasons why I hatched a Tiesel from the lovely people down at the crafts place. So we've done those two. Now, you all want, let's see, the younger ones here don't have to play sticky back. So you all know what this is. And when I was young, you gave me this called sticky back. Whoever got it, do you want to pass it on to each other's backs? And this is a lovely herb designed for your pot, teapot, along with the nettles, especially in the summer, and elderflower. And don't really feel them and smell them. Right? Herbal, there's a word for it which is found for me now, which is the organolepsis. See, I love words as well. Organolepsis, which is the touch, the feel, the smell, the effect on your, and you then see what all of those have an effect on in your internal balance, and then you put them in the teapot, and then you smell the teapot, and we put a cover on them. If it's very smelly, like this one, we pass this around, just delicately pinch a little bit, and you get the, so just so there's a few seeds left and people get around. Now that one, you would put a cover on your teapot, which is why they invented covers on teapots rather than mugs, so that it keeps in the aromatic oils, because the aromatic oils are the important things for healing. They're the most important, but there are other things for healing. So fennel is very prolific here, even though it's primarily a Mediterranean herb. And it's a very nice one to plant in your garden. You don't need to plant the Cleavers, do you? I love weed medicine. Then you don't have to even weed, because they are the weeds. The Cleavers, or the sticky back, is lymph clearing. Okay? There's two fluid systems that are highly high sources of therapeutics for herbal medicine that are barely mentioned in medical school, and that's bile and lymph. We recirculate 15 litres of lymph every day. We mainly, it's the tissues between the cells, the fluid between the cells is gathered by the lymph system. It's gradually organised into structures of vessels. It passes to our lymph nodes. It's eventually delivered into our cardiovascular system here. How many of you knew that? Yeah? Anybody else? No. Interesting, isn't it? And bile is so undervalued by medicine that they build people's gallbladders out now more readily than ever before. Because it used to be major surgery, they would manage things conservatively for a while. But because now it's keyhole, and people are in and out after 2 or 3 days, one episode of an inflammation of the gallbladder and you're down on a waiting list for gallbladder removal. And our bile, now if you have an absolutely non-functioning, leathery pouch bag of your gallbladder, it's no good to you. But I think a lot of these gallbladders are recoverable. And the reason why the bile is so important is that it regulates the breakdown and emulsification of fats in your digestive system. So it's part of one of the reasons why there's an obesity epidemic, is because we don't eat bitter foods. Who here ever eats bitter foods? Whoever puts dandelion leaves in their... Yeah. Okay, you guys get on it. Dandelion leaves, so out to your garden, pick a dandelion leaf, put it in your salad. Now you don't want a whole salad made of dandelion leaves, because even I don't do that. I think it's taro or right? But 1 or 2 dandelion leaves, it actually gives a bit of a bite. Right? And it actually, you kind of, eating salad from those plastic bags, it's kind of like nothing. Right? You want something with, you don't really eat that.
I eat salad,
Yeah.
I don't know.
Oh, brilliant, yeah, so that's good for bite. So throw in the dandelion leaf with it, yeah. So the lymph is how, and one of the reasons for exercise is how we get the lymph is from our calves pumped back up into our system. So if you don't walk up and down stairs, if you don't walk up and down hills, if you don't vary, if you're all the time walking on concrete, you need to get walking on grass, sand, up ramps, down ramps, up hills, over boulders, within your capacity. They're all part of the variability which keeps you stable. Right? So a lot of this is about maintaining health. So we've done that one and that one. This is the poppy plant. Now therapeutically we use the California poppy, but you can actually use the Welsh poppy, the yellow poppy, and the red poppy. It's just that they're for therapeutic use, they're fine for home remedies, but we would tend to use the California poppy, which is a really common garden plant. Yeah. So the latex in these, this is the, people say to me, oh, herbal medicine is just leaky, like doesn't really do anything, really does it? And I go, well, we have opium, not that I'm suggesting you all become opium addicts, but this is, the poppy seeds on your bread is from this plant, okay? So the seeds are nourishing. It's the latex that's used as a sedative, all right? And the leaves and flowers in the Californian poppy are enough to give it a sedative effect. So that's why the poppy seeds in your part of your diet are very good. Seeds in general are good in your diet. Now here's another one from our Mediterranean cousins, and again you can, even doing that is lovely. The sensuousness of herbs is part of the richness of our daily life, really. So lavender is antimicrobial, anti-inflammatory, calming and sedative. You can put the leaves and the flowers in your teapot, very nice. The essential oils needs distillation. There's a big kind of impetus now to use essential oils internally. I'm very cautious. The essential oils are when you pass it through a distiller and you isolate the very, very, very small, very, 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 very concentrated volatile oils. They're very strong, like even as a herbalist, I use them very seldom, like for a very resistant pneumonia, very chronic, systematic thrush, very wary time. I don't really recommend them for home use. What led me on to that? Oh yeah, so you can use the water that's left over from distillation is the aromatic lavender oil. Very, very nice for topical use, for a spray, to spray on a baby's pillow. The essential oils, you can put little dots on pillows, particularly for older people. There's a lot of research evidence to say that it calms restlessness in children, and the herbal medicine, we use a lot of the same herbs for seniors as we do for infants. So, and they respond extremely well. This is just not really smelling. Nope. Too quickly for time. That's why it's heather. Yeah, that's why, and the smell it. Yeah. So always just take time to consider all the attributes. We use Cannula vulgaris as an antiseptic, particularly for the urinary tract. So it's very, it's a very nice herb that we would use for urinary tract infections. People often know of ones that are wider afield. I don't quite know what that one is. Oh yeah, this is interesting. This is epilobium, or the small willow fern. There's a lot of affiliated knowledge in Germany with Maria Trebens. I don't know if you have heard of her. And there is a small amount of research for men's prostate health. But when I say men's prostate health, I mean pelvic congestion. More and more men are suffering from pelvic congestion syndromes of pain and discomfort in the pelvic region because they are sitting on desks behind computers, and that's not a good design. Okay? Nobody should be behind computers for 8 hours a day, but men in particular, they need to be running and digging and pulling and yanking and so we're doing stuff outside. Yeah. Any men disagree with that? Yeah. Men need sheds. It's just their constitution. It's their energy. Constitution and energy. Oh, see, this is the bit of herbal medicine that is very difficult to analyse. If you look at every system of traditional medicine, it has an energy system recognized. In Ayurveda, it's the doshas. In Chinese herbal medicine, it's the wind energy, wind, fire, wood, and sun, is it? And the chi, which is balanced. If any of you know the Enneagram, I find it a great clue to people's constitutional energy. So while that's a generalization, men are physically stronger, they have more physical, different distribution of energy in their body, it's more evenly balanced. Women, it's more from the hips down. And men, have that different kind of energy.
Maybe it's that when you're all doing things and moving around and
Yeah.
their energy differently.
Yeah, and neither should be behind a computer for 8 hours a day, because we're not designed. So that's why it's so important to keep moving. But just for men, I suppose I'm emphasising it because previously men did not suffer from pelvic congestion problems, whereas women did. Women are now not on their hands and knees scrubbing floors and doing the front tiles with red admiral. I go back that far. So the kind of, every era has different illnesses. Before my generation it was TB and poor diet related to infectious diseases. I had rheumatic fever as a child. I haven't seen a child with rheumatic fever since I qualified. Each era, depending on, we are now finding a lot of chronic disease, chronic degenerative disease, autoimmune disease, dementia earlier and earlier, because we're not moving, we're not drinking enough, and we're surrounded by toxins. Right? So I think all of that is becoming generally recognised. And that's one of the reasons why, I would say don't have anything but skull and crossbones under your kitchen sink. Because why would you? So you could clean virtually everything with sodium bicarbonate, lemon juice or vinegar, right, and just root it all. So we've created an environment which is difficult for our internal systems to balance. So that's the basis. So every patient who comes and sees me, I'm trying to read what's the balance of external influences, internal influences, food, rest, all of these things in making the preparation, but herbal medicine professional consultation is a complex protocol individually designed with the patient, tuned into the patient, so it's more than just the sum total of the herbal prescription. So the therapeutic relationship and mentoring through some of these changes is part of the experience. Yeah? So you cannot do herbal medicine in 10 minutes, in other words. That's the practical thing. That was the bit where I kind of thought, oh, sugar, I'm in trouble here, because I remember not to say anything rude. So that's why when I realised the depth of herbal medicine and the reason why my patients were getting well is the tuning in to their individual energy deficiencies and things that need to be healed. So it's more than a biomedical approach. And my use of herbal medicines is according to traditional use. And if there is science available, it usually backs that up, which makes me very happy because I love science too. Yeah? So it's all collaborative. And it's all collaborative with the necessary medication that one might need. Yeah? For diabetes or whatever the problem is. So, now the next pretty flower with 3 leaves, I think that's more heather, is red clover, yeah, red clover, which has the 3 leaves. So it's trifolium platens, all right. So this is used for lymph. So I would use this for lymph drainage for somebody with hormone balance problems. I would use the cleavers, the sticky back ones, for somebody who has chronic skin problems. So that's just to give you a differentiation as a herbalist as to which I can use. Now a little bit of either of them in your teapot is fine, okay? These are also rich in plant estrogens, which is very good for balance, that's why it's used for hormones. If somebody used that amount in their teapot once a day, I would have no problems, even with breast cancer. There's a big myth that plant estrogens and breast cancer, even the estrogen positive, are problematic. Whereas in fact, and you can smell that and see whether there is or isn't a smell. Sometimes it's important to more important, or as important, to recognise whether there isn't a smell as whether there is, because it will help you differentiate from one that does have a smell. Plant estrogens are very weak estrogens compared to our own biological estrogens. So the estrogens that we make as part of steroids, hormone balance, are very strong. Estrogens don't mess with the hormones, right? So if I take a little bit of plant estrogens, they lock the receptors, so all the biological estrogens have to float around looking for another place to park. So in other words, you're blocking the very strong estrogens with the very weak estrogens. Okay? So you still want to just use them in food amounts. I don't advise people to take supplement amounts of plant estrogens because I don't have the balance of traditional medicine and it's like we knew from the effects that these were good for lymph and balancing hormones. It was only when they isolated plant estrogens and they did different affinities and different strengths that we can now say this is the science. Do you see what I mean? But the traditional use comes first. But there isn't the traditional use when it comes to high levels of plant estrogens in supplements. I hope somebody's keeping an eye on the time because I'll keep going for them. You are? Okay, good. How long have we got? 10 minutes. She says 10, she says 15.
When are you supposed to be done?
All right. I kind of reckon an hour is plenty for people.
What's this one?
What are these ones?
Oh, well, it's my raspberry plant.
Oh, raspberry plant. Right, raspberry leaf tea. So raspberry leaf tea, people know about. It's funny, I don't recognise it because there's so many leaves that look like that. It could be from a tree or a bush or whatever. So, so I don't expect it to be smelly. I should have checked first. But that nice green, anything that green is full of vitamins and minerals. Yeah. So that's good to start with. Oh, we forget that medicinal herbs are also basically nutritional. And people don't eat enough greens, do we?
No.
So raspberry leaf is good for particularly for the last trimester of pregnancy, because it's a toning herb, not a stimulant. There's a difference between toning and stimulating. So it's a toning herb, which has been shown to be safe, because they have done research on it, and it has been shown by research that women who take it in the last 3 months of pregnancy have a slightly easier time of it. So I think it should be given to everybody, all right? But it's also toning for the digestion. You see, if something is toning for one thing, it's often toning for more than one thing. So this also tones the digestion. And if any of you heard of leaky gut, or SIBO, small intestinal bacterial overgrowth, which is behind a lot of the fatigue and brain muzziness and lethargy of a lot of modern, that a lot of people suffer from. A lot of us don't even know we're suffering from it because we can't remember what it was like to feel any different. You know, is the other thing. But this is very good for toning and sealing the digestive tract. Leaky gut happens. Should I pass some of the other side? Leaky gut happens if the seal in your gut, lining your gut, is not tight. So if you can imagine that your gut wall is like a mesh, and there's little slight openings. Right? You will see a little bit of light going through there. What the raspberry leaf and agrimony is another native herb that you find in hedgerows. What that does is it tightens, okay, and tones the smooth muscle in the wall. So that's very good for irritable bowel. So it goes from letting the light through to, okay. So this is very useful for irritable bowel and SIBO and leaky gut and chronic fatigue for any reason, because I can guarantee you that anybody with chronic fatigue has poor tone and sealing in their gut. Herbal medicine goes digestion, 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 in the same way that an estate agent will go location, location, location. There's no two ways about it. If you do not have pretty pink digestion, bowel movements every day without needing smoke or cigarettes or coffee, and you never have reflux or heartburn or indigestion, but nearly everybody who comes with chronic problems has at least one of those problems, often constipation. All right? So nearly everybody needs some digestive tuning before we address the hormones or the migraine or the asthma or the whatever. Yeah. Did we do juniper?
No.
This is spiky. Not particularly smelly, but that's where the juniper berries come from. Juniper berries, along with thyme. We did have thyme. We're getting there. We're getting there.
That's it.
This one? Yeah. Okay. I don't use that particularly. Yeah, there's the thyme. So juniper, thyme, rosemary. I thought I had a rosemary. No, it's just too soft. So along with juniper, thyme, rosemary, sage, all of those smelly native stuffing herbs are all antimicrobial. In previous times, we didn't have diorolite, we didn't have central heating, and we didn't have ensuite bathrooms. So if you got gastroenteritis and you were heading to a ditch or a compost toilet in the middle of the night, and it was particularly serious for children and older people, there was a high risk of death from gastroenteritis. Right? Same way as there is in the third world. The biggest enemy worldwide of good health is famine and war. All right? And they usually come together. We brought most of our catastrophes on ourselves following the war. So, but what you wanted to do was treat the food before it gave you food poisoning. So what they would do is they would wrap the meat around these antimicrobial herbs so that they would kill the bugs rather than making us sick as a community, right? And you can imagine if one person got it, that'd be bad enough, but if half the adults got it in Crinio, how bad would that be? Okay? So all of these, we think that all of these herbs in our food are because we think they taste nice, but in fact they're there to keep us safe from the food that we eat. And this brings me on to the number of people who come in and say, oh, but I don't like this food or that food or the other food. And you start off with your health, that you eat the food that you need rather than the food that you like. Okay, somewhere in the last 20, 30 years, people have got the impression they have to like what they eat. Right. That's a complete myth. Right? You find out what are the foods that you need, and you eat them. And you don't think about it. And eventually you get to like them. Believe me, I can't eat foods I didn't think I would ever prefer. Everybody is allowed one or two that they really, really don't like. But you eat 5 to 7 fruit and vegetables, preferably 7 to 10, more vegetables than fruit. The Department of Health says eat a minimum of 5. And I'm like going, no, eat an optimum of 7 to 10. Because you just look at the rates of diabetes, autoimmune disease, degenerative disease, Alzheimer's. What the hell would you be taking a minimum of anything for that's good for you? So you take an optimum, which is 7 to 10. If you want to live to be 110, you take 10 to 15. And up an hour, I think, which is the longest, up an hour? There's one place in Japan where they all live to be 112. And also in the Mediterranean island, where they grow their own food and they eat lots of, and they get sunshine for vitamin D, and always helps. And do karate. Keep active, yeah. Or they do it, keep I get the point. So, so that's the take-home message, is that you go to your shopping list and you go, what do I need to be healthy? And you fill your shopping basket with all of that. Okay? And then you go, what's the treat? Something you have every day is not a treat. Okay? It's something you eat every day, so by definition it's not a treat. Okay? So I'm not saying be miserable and don't have a birthday party and don't have Christmas, but the vast bulk of your shopping basket is healthy food. Alright? Which include berries, right? What's our native berry? I'm going to see you all with your buckets, and especially anybody with kids, spread the word. You're all having a blackberry picking party, which are the briars. The buds are also very good, particularly for the cardiovascular system, and the leaves do exactly the same thing as the raspberry leaves. So you can also use the raspberry leaves in your teapot. Yep. Okay. Now, this is the trick questions. When I was going around, I don't have to go home smelling a muck. So in here you will see, it's hard in the light, you'll see chickweed in amongst the grass. They're all under the trees. And you'll see a little, you look at the mown grass out there and you'll think, that's all grass. But it's not. The light actually helps there, Tara. Do you see the little millifolium? Millions of leaves, or thousands of leaves. In the grass out there, it's full of yarrow. Left, not mown, these would be flowers this high, it's not a daisy-like head, and it's not an umbrella head, but yarrow is very, very good for capillary strength, venous decongestion, varicose veins, flu-like illnesses. For flu, one of our teas is traditional flu tea, which is elderflower, mint, and yarrow. And all over Europe, whether I go to Slovenia, Slovakia, Sarajevo, it's universal in Europe. Do you recognise those herbs for flu tea? Elderflower, yarrow? Yeah. Yeah, elderflower a lot. Yeah, it's gorgeous, isn't it? Yeah. So the millifolium one in there. Aha, look at this fellow. This is Scrofularia nodosa, or figwort. And this is very good for lymph drainage. Now this is the Mr. Tough guy, all right? And this is where the stubborn stuff. I use this for seborrheic dermatitis, psoriasis, and you know the acne rosacea, and you get it as a flare across here. This is for more stubborn, and like so. Can you see that there's a range of lymph herbs here? The Cleavers is for everybody who wants a spring tonic. The Cleavers is for hormone balancing problems. This is for chronic skin, much more stuck systems. So there's a range of lymph herbs, and I use them under different circumstances, blended with different herbs. And all the different herbs have synergistic actions, they all blend together. When I first started learning about herbal medicine, echinacea was good for this, that, the other, and Granny's complaints as well. And I was like, yeah, right. Yeah. I now realise the reason why that's true is that each herb has 350 constituents, made up of flavonoids, glycosides, terpenoids, aromatic oils, one of the big bitters is a big one, and alkaloids, right? But each, like all of these, are made up of those basic groups of chemicals, but they all have slightly different, you know, the same way your carrots and parsnips are very similar, aren't they? Mm-hmm. But yet they still have different constituents. But they're warming and nourishing and in slightly different ways. So in the same way, the herbs are the same. But by the time you blend this one with dandelion root and a nervine and an antiseptic for the urinary system, you have a particular soup, right, of herbs. Now, the healing agent is you, okay? So depending on the state of you, the you-ness of you, and how robust it is, and how floppy it is, and how tight it is, and how hot it is, that's how I tune in the 6 or 7 components of a herbal blend, so that it matches what your terrain is ready to heal. Okay? If it's an acute infection, it'll be masses of antimicrobials and fever managers and getting the circulation going and supporting. It'll be big doses, frequent doses in a small period of time. If you have chronic Lyme for the last 15 years, it could be teas made up of very gentle herbs that in combination offer a healing medium combined with your healing state or readiness or state to be healed. So there's 2 healing agents. There's the blend of herbs and there's the person. And I'm getting...
What was that one that you just had?
Figwort, scrofularia nodosa. I can't go without mentioning dandelions, so make sure you put those in your food and in your diet. The root is good for detoxing for the liver. Okay. Thanks a million, everybody. You've been a very attentive audience, given how enclosed it all feels. So you're going to go home and use your teapot and dig your garden and enjoy the. But the other thing that herbs remind me all the time of is how abundant nature is. And how supportive it is for human beings.
Wow.
So
Chickweed, isn't it? Chickweed is in there somewhere. There it is. What is it? Chickweed? Oh, chickweed.
No more skull across
Your skin.
and please no more Roundup. No more Roundup. Roundup is no more Roundup. Okay? You don't have to promise me, promise yourself.
Thank you.